Good morning, Mr. Minister.
Good morning.
How are you?
Very well, thank you.
Happy New Year.
Happy New Year to you too.
Thank you very much for your time to grant this interview.
Well, it is my pleasure. It is my pleasure.
Firstly, please update us on the current status of the November 5 fire victims.
Well, we, as you know, it was a very disastrous event that took place on November 5. We're very sad. We saw that there are lots of victims who were burned beyond recognition. We were able to provide the best services that we can for the victims. Plastic surgery in some cases. As you know, some of them had third-degree burns. Some of them have 80% of their bodies impacted by the burns. So it's a long road to recovery for them. But we're very pleased at the medical reaction to it. We're very pleased that we're able to get additional help from our friends in Senegal, our friends in Liberia, our friends in Italy, our friends in the US, who all came to join us to respond to these. Again, I think it was a clear show of how responsive the medical care was in spite of the difficulties that we had. I tell you something, anywhere in the world, if you have 100 burn victims show up in your hospital, in your country, it's a major, major disaster. I think we're able to manage it well in our country.
Okay, thanks for that update. Sweden still experiencing a high increase of the fourth wave of COVID-19. What are the latest figures and what is the ministry doing about boosting vaccination?
Well, to crush the first wave. We are able to crush the second wave. We're able to crush the third wave as well. And right now, with all of the holiday makers that came in, we had a spike in the number of cases that we're still paying close attention to. But this just reminds us of the four major mitigation factors that we need to focus on. Masking, which is really quite important, social distancing, hand hygiene, which is really quite important, but most importantly, the vaccinations. So right now we've been able to have about 1,065,000 people vaccinated in the country with at least one shot of the vaccine. We have about 7.8% of the population have received a full dose of the vaccine. These are large numbers, but they're far short of where we ought to be. So we're working really, really hard. We've had three major waves of vaccinations. We call them surges. Normally, when we're vaccinating, when people have to go to the sites to get vaccinated, we have about 500 vaccinations a day. During the first surge, we were able to get as high as 13,000 a day. By the second surge, we're doing about 15,000 a day. By the third surge, we're doing about 17,000 a day. And I think right now we're planning on a fourth surge, perhaps at the end of this month, early next month, to see if we could have a major, major increase in the vaccinations. What I've seen other people do is to have like a solid vaccination week where we could target like 1 million people being vaccinated throughout the country. I think what we've seen is that people have overcome those early hesitancy issues. Now it's more of an issue of convenience. Yeah, I don't want to stand in line for too long. I don't have time for it. But we know that if we take vaccinations to people, they're willing to take it. So again, we're in a good place, but we could be in an even better place because we're targeting by July to have 70% of the population vaccinated. Now we're just under 8%, so we have a long way to go.
Okay, 2022 is here. What should Sudanese expect from the health ministry this year?
Well, this year is a year of delivery. I told you about what we've done in the vaccination space. For example, this is the first country that launched a vaccination for Ebola, where we had that there was cases of Ebola in Guinea. We were able to acquire over 20,000 years of vaccines to vaccinate our frontline healthcare workers. We mounted a robust response that prevented cases from spilling over into our country. We've had measles outbreak. We've had polio outbreak here with 32 cases of polio. We vaccinated about 1.5 million children and prevented the polio from spreading. And right now we haven't reported any case of polio. So these are distinct accomplishments just in the vaccine space. I mean, for example, right now in our immunizations, we have recorded over 80% of vaccinations for measles, over 90% vaccinations for the pentavalent triple vaccines, and we actually made it in the MCC scorecard as one of the major accomplishments here. So we've done well in spite of COVID, in spite of the difficulties in 2021. So in 2022, also in 2021, we were able to work on some policies, work on some strategies. We've been able to raise funding for the global fund that focuses on TB, HIV, malaria, and health systems from an initial $60 million to over $157 million. We have a new project from the World Bank focusing on health systems in general that's increased to about $78 million. So with all of these and all the planning that's taken place at the late part of 2021, this year is the year of delivery. This year is when we're going to focus on primary health care. We have 1,500 primary health care units spread throughout the country, which means that everybody, every Sierra Leonean is within a 5-mile radius of a health facility. Our big challenge now is to bring quality to these facilities. So we're looking at a 3-point approach. Number one, focusing on physical infrastructure to make sure that these places have water, electricity, and they look like a place that somebody would want to go to when they're sick. We want to be able to focus on the second major component, which is the health workforce that's there, making sure that we have the right complement of workforce. It means doctors, nurses, midwives, and CHOs, and health support staff, lab technicians, etc. The third component is we want to be sure that we have drugs and medicines available in these facilities. That's just on the primary health care side. On the hospital side, we're looking at major hospital improvements across the board. In fact, the government just approved about 70 billion leons for improvement of the major hospitals in the country. We're working on that. The contracts have been awarded. The government has given a 30% award. Now what we're doing is scheduling these improvements such that the contractors just don't go there and do whatever they want to do. We're going to make an arrangement such that the contractors go out there. We invite the recipients of these services to all sit together and say, McKinney Hospital, Bow Hospital, Kamakuri Hospital, or Banff Hospital, these are the expectations for improvement, and have these people work towards achieving them in a timely fashion. Most importantly, what I've heard a lot of people say is that they're worried about the attitude of the nurses and the doctors when people come into facilities. We're a listening ministry. We've listened to this, and I tell you, we're going to work really, really hard in 2022 to change that perception. If it's just a perception, we'll change the reality of it on the ground by focusing on training, by focusing on making people understand what the expectations are of them, and understanding that all of our activities should focus on the patient, on the client. The patient and the client, they are our bosses. This is a new approach that focuses on patients and clients, and we're calling it the patient-centered care, the client-centered care, and that will be our focus in 2022.
Okay, what can you say are your successes since your assumption as the Minister of Health and Sanitation?
Well, there's several successes. Again, some of it is not visible because we stopped Ebola from coming here. Some of it is not visible because we stopped the spread of polio in the country. Some of it is a little visible because you saw how we responded to the fire victims here, and I think we got kudos from everybody around the world about how we were able to manage this from a hospital standpoint. Some of the things that we're doing now is to make sure we can improve the health workforce that's available here in the country. So we're making arrangements to see how we could increase the number of doctors that are being trained, increase the number of health workforce that's been trained, looking at creating the strategy for not only their training, but their distribution, and ensuring that we're not only looking at distribution, but we're looking at retention issues. So all of this is being in the works, and I think 2022 is when we're going to try to actively apply them. So I'll say, even in the midst of COVID-19, we've been able to score some tremendous successes in the health sector, but that's just the start. 2022 is when we really start delivery on that.
You cannot talk about successes without challenges.
Yeah.
What have been some of the challenges?
Well, some of the challenges are just first, the government has invested 11.6% of GDP into healthcare. That is significant. That's a large chunk of money. It went from 6-7% to 11.6%. That's a large chunk of resources. The biggest challenge is, how do you make sure that you get that at the end of this month, early next month, to see if we could have a major increase in the vaccinations. What I've seen other people do is to have like a solid vaccination week where we could target like 1 million people being vaccinated throughout the country. I think what we've seen is that people have overcome those early hesitancy issues. Now it's more of an issue of convenience. I don't want to stand in line for too long. I don't have time for it. But we know that if we take vaccinations to people, they're willing to take it. Are doing what they're supposed to do, even as we look at increasing the numbers. So managing health workforce is a really big challenge so far. The issue of, for example, HIV, TB, and malaria, understanding the burden of disease in the country has been a real challenge, because we know that there's a lot of transmission going on, and it's very difficult to address it if you don't understand the burden of disease. There's a lot of stigma associated with HIV and TB. We want to be able to remove that stigma. That will allow us to identify people who are positive, because there's a good drug, there's a good treatment that's available now, to be able to make that treatment available to people for HIV and AIDS. Again, the biggest challenge that we have right now is around COVID. How do we increase the number of vaccinations from our 7.8% to 70% in the next 6 months? We don't have any problem with the vaccines. Vaccines are available. We have about 3.8 million doses available to us. We could get some more if we want. The vaccines are free to everybody. The vaccines are efficacious. The vaccines have minimal side effects, if any. So again, for us, it's more, how do you have these incredible assets that are available to us in people's arms to protect them? And so those are some of the real challenges. But all these challenges are great opportunities to turn things around.
What have you done differently to address some of these challenges?
So what I've done differently, or what I'm going to be doing differently, for example, with vaccination effort, is to look at our staffing. Our staff. So it's a two-pronged approach. Look at our staffing to ensure that we set some clear targets for vaccinations. It's not a passive process; it's an active process. So you have a team that involves social mobilizers and vaccinators, working together as a team to make sure that they actually increase and impact the kind of numbers that's required, and give people targets to work towards. Now, if you fulfill the target, you get your requisite compensation. If you do over and beyond your target, you get a bonus. It's performance-based vaccination that we're looking at. Secondly, we know that none of this is going to be done effectively without the people's cooperation. So expending some time in social mobilization and explaining to people what this is about, but also understand their constraints. Why aren't you going out to take this really, really good product that's available for you to protect you and to protect your family? Why aren't you going to take it? We need to better understand that and address their concerns as we increase the numbers. But I'm committed to this, and my team is committed to this. And I think if we take the time to explain what we're trying to do to the population, we will get this done. There are other African countries, Rwanda, in about a week, they were able to use up all of their vaccines. There are other countries that have demonstrated incredible success. I think we're capable of doing that. We could do that. And this year is the year I'm going to try to work with my team and work with the people of Sierra Leone to make sure that everybody is protected.
What are you doing now about alleged reports of corruption in some institutions of the ministry, such as hospitals?
Well, corruption is fighting corruption is my number one priority here. One of the first things I did here was to engage the ACC. And we have a formal memorandum of understanding with the ACC to help us with two things. First, we don't want to fight corruption for corruption's sake. Our first effort is to prevent corruption in the first place. So we're looking at mitigation efforts. We're working with ACC, we're working with country efforts to be able to look at mitigation, prevention in the first place. And we're doing audits to find any element of corruption. And if we do that, people are going to be punished. We're going to be punished very, very effectively for going against it. And there are no sacred cows, including myself. I'll start with myself. If I'm caught in any corruption, I want to pay the full price of it. But again, you start by the example. And in my case, anything that I'm not sure of, that I'm uncomfortable with, I call the ACC in to help us investigate. So that may make some people uncomfortable, but if you're doing the wrong thing, then you're uncomfortable. If you're doing the right thing, you should not be afraid of the ACC. They should come at any time. So we're fighting corruption. And I think also to remind people that corruption is two ways. What we're trying to do in the hospitals now is to publish a charter. I think you see in Connaught today, they published their charter and what price it's at. The intent is to let everybody know what the cost is. The government is providing free medical care for the most vulnerable, that is pregnant and lactating women, infants, people with disability, people who are survivors from Ebola. The government is providing free medical drugs for them. But for everybody else, what we're trying to do is to ensure that the medicines are affordable, they're reasonable, they're standard high quality products. So what we're looking at now is a public-private partnership that will allow real, genuine, legitimate pharmacies to work inside the hospital settings, that will allow people to get the right diagnosis and get the treatment they require. So none of this Ghana must go backs in the hospitals and all this stuff. If we find anybody doing that, you will be, you will face the full course of the law. So again, we will fight corruption, but we want the public to help us in the fight with corruption. You know that the published money for hernia operation is X leons. Yeah. If somebody goes and asks you for X times 5 leons, if you pay that person, you're contributing to the corruption. So we will hold our people accountable, but you also have to help us out. If somebody says the published cost here is 5,000 leons, and they say pay us 25,000 leons, if you bring it to attention, we'll bring that person to book. It's not even an engagement with us and them. We just call the police, we call the ACC on them. The ACC knows what to do. So it's a big fight that we're all in together.
Generally, tell us the total number of nurses and doctors from those.
So again, I don't have the exact figures with me, but I know for doctors in particular, we have about 475 doctors in the country. We know that over 100 of those doctors are administrators, and they're not providing clinical care. So in effect, we have just over 300 clinical care providing doctors in the whole country of 8 million. And Sierra Leone needs 5,000 doctors to be able to do this work. So if you have less than 500 in the country and you need 5,000, there's a lot of work that needs to happen. So right now, are working with Commerce. Commerce produces 50 doctors a year. Well, 50 doctors a year, for us to get to 5,000, it'll take us 100 years, provided nobody retires and nobody gets sick. Right? So I think what I'm saying is we have a big problem in shortage of doctors. And I think what we are doing now is a two-pronged approach. First, the young doctors that we have in the country right now, we want to encourage them. We want to let them stay on and not leave the country. We want to provide opportunities for them to do postgraduate training on site. So we just launched, the president just launched in the middle of the year last year, the postgraduate training program for doctors, covering medical and surgical postgraduate training, covering nursing postgraduate training, offering pharmacy postgraduate training. So this is an opportunity to grow the people who have, so that they will become consultants, they become faculty down the road. But on the basic training side, last week we just spoke to Professor Alpha Youyi, who was my predecessor here and has gone to a higher education now. We're creating some partnerships there to look at how do we expand the number of doctors trained from 50 to 200 a year, and what that will mean. We're looking at faculty, looking at training content, etc. We have a large number of nurses, and midwives, and CHOs in training, and I'll give you the numbers. I'll look them up for you, but clearly there's still not enough for a population of 8 million. So again, what we're trying to do is not just to train. We're looking at a multi-step approach. First, focus the need. What do we need? What do we need in Sierra Leone in terms of doctors, in terms of nurses, in terms of midwives, in terms of subspecialties? And train towards that. You know, maybe we'll have a cardiology institute. How do you train nurse cardiologists, medical cardiologists who will be working in that space? So forecast the need. Train towards that need. And as you train towards that need, look at the distribution of the staff. As you look at distribution, look at retention of the staff. So it's a comprehensive effort that we're looking at. We're also looking at, with all of these primary healthcare units and hospitals, we want to be able to have a rational approach at staff distribution. What do you need for a PHU, primary healthcare unit, that has a catchment area of 5,000 people? It's different from a PHU that has a catchment area of 20,000 people. So how do you make sure you have the right complement of staff in all of the different PHUs? So we're setting that up and having an electronic system for helping with recruitment, redistribution, and postings. So that's ongoing. And the last thing about staffing is we're thinking of building some new hospitals in the country. I mean, a lot of the regional hospitals in Bow, in Kenamai, in McKinney, those hospitals were built in the 60s and 70s and the 80s for a set population. The population has grown. The medical needs have grown, yet the physical infrastructure remains the same. For some of these hospitals, you want to bring bigger equipment, more sophisticated equipment, more staff. The physical space is not there. So what we're trying to do now is to see if we could build some new regional hospitals, 150 bed, 300 bed hospitals in the 5 regions of the country to support our needs. The good thing about it is, as you build these hospitals, it's important that they become teaching hospitals so that you could have nurses training, doctors training, residency training in this hospital that will not only benefit the students and the residents, but benefit the population as well.
Where do you think we should start in solving the many challenges which the nation faces in terms of health?
Well, we're starting now. We're starting now. And one of the things that I'm really working on also is I don't want our decisions for healthcare improvement based on opinion, based on expert opinion. I want it to be based on data and evidence. What's the data telling us? And so there's a very strong emphasis on metrics, there's a very strong emphasis on data, there's a strong emphasis on data transformation. So that if I sit here and somebody comes from Jerome and say, could you get us 2 new nurses in Jerome? I want to look at the matrix and say, what's the catchment population there? What's the need there? And how do you manage? Do they have a gap in there? They may say we want a CHO surgeon, and I might say, well, no, I think there, what you really need is a CHO generalist to be able to take care of the needs. But we all want all of this to be driven by data. So now we're investing in data quite a bit. We have a very active DPPI, a group that focuses on planning and evaluation and data in general. And they're helping us look at all of the metrics, and that's going to help improve the quality of care. We're looking at some clear targets now in 2022 and beyond. We're looking at reducing maternal mortality in this country dramatically. As you know, Sierra Leone's maternal mortality right now from the 2019 demographic health survey was showing about 717 maternal deaths per 100,000 live births. It's one of the highest in the world. With the presidency's leadership and his instructions to us, you have to change that narrative. So starting in 2022, we're going to aggressively pursue reducing maternal mortality from 717. We set ourselves a target of 300 per 100,000. But that's a dramatic shift from 717 to 300. And that's just the start. So it's not just theoretical. What we're doing is we have a 5-point approach to this. Number one is we know that 14% of the maternal deaths occur in teenagers. So you have a high number of teenage pregnancies, and with these teenage pregnancies, at times they go out and try to stop the pregnancy and abort the pregnancy, and it results in catastrophe in deaths. So we want to aggressively pursue reducing that number by reproductive health education, by making commodities available to teenagers in teenage-friendly environments, and hopefully reduce the number of unwanted pregnancies and the associated mortality associated with it. So that's one. The second thing is, I told you about the 1,500 primary health care units. We're going to focus on these units and make sure that they're ready to manage pregnancy. Pregnancy is not an event. Pregnancy is managed through over a 9-month period. We want to identify these pregnant women early. We're developing a new app that you could use on a push-button phone that will let you, at one hit, it will tell you all of the facilities, the medical facilities that are within your 5-10 mile radius. It allows you to pick the facility that you're comfortable with. We work with that facility to get you a caseworker that will work with that pregnancy. We'll make sure they go up to their regular routine visits. If you can't come, somebody will come and visit you. We want to have a minimum of 8 visits during that period, such that if you have high blood pressure, we'll manage it. If you have diabetes, we'll manage it. If you have other underlying conditions, we'll manage it, all the way to labor and delivery. So we don't want to find out when you come up to deliver that you've had unmanaged high blood pressure, you've managed diabetes, you have unmanaged diabetes, you have unmanaged comorbidities that will lead to a difficult delivery. So we want to do that, and some of the separate care that takes place at the site of delivery is a priority for us. So those 1,500 sites, as I mentioned to you, are going to be active starting this year in looking at deliveries done properly. So that's the second point. The third point is we're going to make sure that we have a referral system in place that's very, very effective, such that if you have difficult cases that we've identified early, we don't want to wait for a crisis to occur. We'll monitor them very closely. We'll make sure that we'll refer them from the primary health care unit to secondary or tertiary unit early enough for them to benefit from interventions. So the ambulance service and the referral network is going to be very, very paramount in our quest to reduce maternal mortality. The third component is if these people are referred to high-level care institutions, secondary and tertiary institutions, these institutions have to be ready. So we're making major investments in these institutions in terms of physical infrastructure, in terms of equipment and supplies, in terms of the staff complement that's there, that's able to manage these complex cases, and make sure that the drugs are available there as well. So that's the fourth plank in our approach. The fifth plank in our approach is to ensure that we have data that monitors pregnancies throughout the country from a national level to the district level to the chiefdom level to the neighborhood level in real time, so that you can sit here and see where the pregnancies are, where the safe deliveries are occurring, where the challenges and difficulties. We do it on a week-by-week basis, so that if we see that there's an unusual increase in the number of maternal deaths in one area, we'll go in there. We'll get a SWAT team now, we'll go in there, a rapid response team now, we'll go in there, not in a punitive way, but to find out what's going on, what's not working. Do they need more staff? Do they need more equipment? Do they need quicker referrals? Do they need more drugs? All of what is needed to fix that problem. We won't depart until that problem is fixed. And what we'll do is we'll collate the information on a weekly basis. And then we won't wait for the end of the quarter to intervene. We'll intervene in real time. I think that's a strategy to help reduce maternal mortality in this country. And I shared it with our colleagues in Harvard University. They were so excited about it. I shared it with the World Bank. I shared it with multiple partners. We're all so excited about how could Sierra Leone transform that image that people have as a country with the highest maternal mortality, to change that narrative. And we could do it starting in 2022.
Well, let's go back to corruption. What is your message or to members of the public who perceive the health ministry as one of the most corrupt institutions in the country against the background of alleged corruption such as the free medical care?
Yeah. So again, you use one word there, which is well, actually two words. Perceived corruption is one, and alleged corruption. Because I think what happens is when you have perceived people, perception is reality. So it may not be as bad as people think, but you deal with people. Your people deal with people's health. So we want to be able to change that perspective. We want to be able to change that narrative by telling our own story. I was interviewed by somebody last night or yesterday, we were talking about, Connaught is bad, they're like, have you been to Connaught lately? Things are happening there, things are being changed around there. So again, I'm not a defender of corruption. Corruption is completely unacceptable. There is zero room for corruption in the health sector. I think we're going to aggressively pursue it. And you go like, what's corruption? Corruption is when you're paid to do a job, and instead you go Mami Coca elsewhere, you abandon your post. That is corruption because you're using taxpayers' money. What is corruption? When there's a pharmacy that offers drugs and you steal the drugs and you go sell it somewhere else, that's corruption. So there are lots and lots of components of corruption that our people need to understand. And I think what we need to do is to remove the gentilism, the nice words that describe corruption. Oh, na chap with the chap, na chop with the chop. No, it's theft. And that theft is resulting in deaths. So we really need to make that clear to our people that this is completely unacceptable. And we will not tolerate that. And we will not even negotiate that. If anybody is found wanting, we don't have enough medical staff here. But it's better that we work with the ones who are good, who are able to deliver the services, than to have a lot of people who are not committed to the service, who are not doing the work. Again, I'll say a huge percent of the workforce is committed to this. There are few people who are tarnishing our reputation. And I think it behooves us in any institution to see somebody who's tarnishing your reputation and you don't do something about it. So I'll ask all of the good doctors, all of the good nurses to join us in identifying these people who are undermining our operations and get them out of it.
Final question. You are very passionate about changing the narrative of the Ministry of Health. Do you believe you can turn things around?
Well, if I didn't believe that, I wouldn't be here. I strongly believe it. And in fact, when you're talking to the healthcare workers, when we're talking to our colleagues, you know, you have these light bulb moments when people believe that we can do this. We can do. I've worked in about 88 countries around the world, and I've seen people transform. I was in Rwanda in 2000 after the genocide, when people were whispering in the hallways and the corridors about what to do or what not to do. I was one of the early investors from the U.S. government to help work with the health sector in Rwanda. Look at what they're doing today. It's a model of success. But I believe that we could do that here. I'll show you what gives me hope. I went to Kono a couple of months ago, and I saw Partners in Health working with the Ministry of Health staff. We worked into the neonatal care unit. They told us that 6 months before, any baby that was less than 1 kilogram in weight died. Every baby died. Now, with a little bit of oxygen that they have there now, they have a small oxygen plant there with a little bit of oxygen and some good clinical care. Over 98% of these babies are surviving. And this was managed by a nurse there that I have so much respect for. Although he told me he's been working for 3-4 years without a PIN code. And I think that if I have a PIN code, you will be number one on my list. So there's a lot of possibilities right now at Kono with Partners in Health. We're building a 166-bed pediatric center of excellence. And they'll have an e-platform that will be linking with Kigali and Harvard University to work on clinical care services for pediatrics in Kono. Right now we're building a brand new hospital at Lumley. It's a 100-bed hospital, $25 million. You know, there's a general hospital right next to it. Although right now we're dealing with some land issues. There are like 30 people who were encroached on the land. And it was a rainy season. We asked them all to leave, but people were like, oh, you can't let people go in the rainy season. Where would they go? So the government agreed to compensate them. We gave everybody 15 million leons to relocate. 28 of the 30 families relocated. 2 families are still Oregon, there. And so we're looking at ways to remove them because the company that's coming to build is coming in March. And we have a choice. Either we leave these 2 people here in no hospital, or we move these 2 people and have a 150-bed hospital for pediatric care. At the same time, right next to it, we have a 100-bed hospital that's being constructed. We're working at Freetown. You know, we're going to have a 166-bed hospital there. Right now, the president has asked us to expedite the process of building this diagnostic and cancer center at Freetown. The government itself has put about $7 million towards it. It's a $13-15 million project. We talked to IAEA yesterday, and everybody's excited about moving this forward. You know, we're building 3 new hospitals, one in Pujan, one in Moyamba, one in Karine. You know, we're also building a brand new hospital in Jujuima. We're building 3 more hospitals in Zimi and Koindu, and a few others. So this year is the year for us to deliver on the health sector. And what I want to do is to take this moment to just thank all of the healthcare workers who are committed to this, who believe in ourselves that we could make a difference, who believe that patient care is the center of our lives. And I think what I want to do is to make a commitment to the public that together with the whole health workforce team, you just watch this space. We're going to transform healthcare in this country.
Any other thing that we have may not discussed that you want to talk about?
Yes, you know, I think one of the issues here we're dealing with COVID-19, and we dealt with Ebola, you know, we dealt with other outbreaks here. I think it's important that we don't have a knee-jerk reactions to outbreaks. We have COVID now. Next 5-10 years, you don't know what else is coming. We shouldn't be scrambling every time there's an outbreak to have a response. We should have institutional capability and capacity to forecast, to prepare for, and to respond appropriately. So what we're working on now is to establish a national public health agency, an agency that has capabilities for surveillance and epidemiology, capabilities for vaccine studies, capabilities for high-end lab work, capabilities for metrics and data and analysis, capability for forecasting. And so a lot of things that are going on that will be housed in this institution. The paperwork is nearly complete. We have cabinet conclusions around it. We finished the legal work on it right now, and I think it's going to be submitted for gazetting. And after the gazetting, we'll lay it in Parliament over the next few weeks, and hopefully we'll have Parliament ratification that will allow us to establish our own national public health agency here. Really exciting, and it's going to start in 2022. So I'm just so thrilled by that. I'm so thrilled about the prospects of that happening, and finding a home for Sierra Leonean scientists, Sierra Leonean investigators, Sierra Leonean scientists to work on this. So I think that's one big thing. The other thing that we're working on also, we're working on cancer, cervical cancer elimination in this country. Cervical cancer is a very private thing, and so people don't talk about it. A lot of people are dying unnecessarily of cervical cancer. We have a strategy now, a strategy to first prevent cervical cancer in the first place, because there's a vaccine for it. So there's a vaccine, and what we're looking at, the target age for the vaccine is 10-year-old. So we want to make sure that all the people that are in primary school, which are mostly 10-year-olds, by the time they get ready to get into secondary school, we make it an offer that they're vaccinated at that time to get protection. So starting this year, anybody that is under 10 years of age will make sure that every year they receive the vaccine so they're protected for life. And for those who are older than 10, what we'll do is active case finding with simple vinegar smear examination screening tests that could identify early lesions. If you identify the lesions early, the treatment is simple. You use liquid nitrogen or freezing. You'll freeze the cells, it'll kill the cells, it'll kill the cancer. And for those that with much more advanced disease, we'll identify them and make sure that they get the requisite long-term care. I want to say that if I'm going to leave any legacy behind, I want to leave a legacy where we say, starting now, anybody under 10 years will never worry about cervical cancer in their lives. So 20 years from now, we could say anybody under 20, no, under 30, 10 years from now, we could say anybody under 20 need not worry about cervical cancer. 20 years from now, we could say anybody under 30 need not worry about cervical cancer. So we will actually look at eliminating cervical cancer in this country. It's not an easy job, but that's the kind of job that the ministry is looking to do. Transformative, big, bold issues here.
Thank you very much, Mr. Minister.
Thank you. Thank you very much.